All right, this is chapter 26. It's going to be an overview of trauma. Um, so in this chapter, we're going to look at trauma scoring, rapid transport destination issues, and transport. Multi-system trauma, recognition of management of multi-system trauma, pathophysiology assessment and management of multi-system trauma, and blast injury. So unintentional injury is the primary cause of death and disability in people between the ages of 1 to 44 years. Proper pre-hospital evaluation and care can minimize suffering, long-term disability, and death from trauma. The evaluation of the mechanism of injury for the trauma patient will provide you with index suspicion for different types of serious and or life-threatening underlying injuries. So the trauma patients are going to be a big population of your patients. So be prepared for these. This is what initiates the 911 response a lot of times. We do get a lot of medical calls also, but the trauma response can make up a big portion of your patients also. So traumatic injury occurs when the body tissues are exposed to energy levels beyond their tolerance. All right, different forms of injury produce different kinds of trauma. Mechanical injury is Mechanical energy is energy from motion. Kinetic energy reflects the relationship between the mass of the object and the velocity at which it's traveling. Potential energy is the energy stored in an object, such as the brick sitting on a building ledge. So, potential energy is us just sitting here. Mechanical energy is us moving or out and about. And then kinetic energy is the relationship between the mass of the object and the velocity at which it's traveling. So, kinetic energy is the speed that we're walking somewhere. Chemical energy is the energy released as a result of a chemical reaction. And thermal energy is energy transferred from sources that are hotter than the body. Barometric energy results from the sudden radical changes in pressure. The study of kinetics is the relationships among speed, mass, and direction of force. All right, different kinds of mechanisms of injury will produce many types of injuries. Injuries sustained by trauma patients may be the result of multi-system trauma, falls from heights, motor vehicle, motorcycle crashes, gunshot wounds, and stabbings. So always maintain a high index of suspicion for serious unseen injuries. And we'll talk about those throughout this chapter and throughout trauma in general. A lot of things can change very quickly inside the body when it results from a traumatic event. So our main idea in helping these patients out is to get them to a facility of perfect care, and we'll talk about that also. So blunt trauma causes energy primarily without anything penetrating the soft tissues or internal organs. Penetrating trauma is injury by objects that pierce and penetrate the surface of the body and injure the underlying soft tissues, internal organs, and body cavities. Blunt trauma results from an object making contact with the body. Motor vehicle crashes and falls are two of the most common mechanisms of injury. So always maintain a high index of suspicion during the patient assessment for hidden injuries. Motor vehicle crashes classified as frontal, head-on crashes, rear end, lateral, T-bones, rollovers, and rotational speed. Three collisions in a typical impact. I always call this I always think of this as the Dale Earnhardt killer. I tell people, to correlate, this is why Dale Earnhardt actually died when he hit the wall at 200 plus miles an hour that day. So the vehicle against another vehicle, a tree, or something else. The passenger hits the interior of the vehicle, and then internal organs of the occupant hit the structures of the body. So you've got the exterior car itself or object hitting an object. You've got the body itself slamming into the car or whatever. Maybe it's maybe it's a person falling. Okay, the person falls out of a tree, they hit the ground. That's the external force. And then the internal force also is the body organs itself hitting upside the body structure. So that's actually what killed Earnhardt that last time. So severe deformity of the vehicle or intrusion into the vehicle correlates with significant mechanism of injury. Understanding the mechanism of injury after a frontal crash involves evaluation of the supplemental restraint system. So determine whether the passenger was restrained by a full, properly applied 3-point restraint. If the airbag did not inflate during the accident, it may deploy during the extrication. Seatbelts may also cause unseen abdominal injuries, and particularly in pediatric patients. Look for abrasions and or traction type injuries on the face, lower part of the neck, and the chest. Supplemental restraint systems can also cause harm, whether they are used properly or improperly. Contact points are often obvious from a simple, quick evaluation of the interior of the vehicle. Ejection results in the second impact injuries when the body comes in contact with the ground or the objects outside of the vehicle. So impact of the steering wheel can injure the lungs by generating pressure in the lungs. Ring of the chest injuries that can occur from impact with the steering wheel or dashboard. Okay. So you see here in this picture, you've got a closed glottis when the steering wheel the seat belts retract on you. They'll be allowed full of air if you, especially you've got air full in the alveoli, and it could cause them an actual rupture. Blunt trauma and rear end collision can cause major kind of whiplashes, ladder crashes with whiplash injury also. So you got that potential for that neck injury. So it may not be a high impact injury, high impact crash. However, you do have to keep in the back of your mind it could cause some type of internal injury to the neck with the whiplash. Rollover crashes and injury patterns are difficult to predict. An unrestrained passenger may have sustained multiple strikes within the interior of the vehicle. Most common life-threatening event in the rollover is ejection or partial ejection of the passenger. And this does happen. So these people suffer a tremendous amount of force to actually go through that windshield because it is a thick object to actually break over. Rotational crashes injuries are a combination of frontal and lateral impacts. 3-point seat belts are effective in preventing the injury. Vehicle versus pedestrian crashes. 3 phases of impact. The vehicle strikes the pedestrian rotates onto the hood, and the pedestrian rolls off onto the ground. So that's your 3 places of impact when a person gets hit or struck by a vehicle itself. The injury pattern depends on the height of the pedestrian and the body area facing the injury. Vehicle versus bicycle. Evaluate the mechanism of injury in much the same manner as you vehicle versus pedestrian crashes. So evaluate damages to the position of the bicycle. and presume that the patient has sustained an injury to the spinal column, spinal cord, or until proven otherwise at the hospital. So I always C-spine these patients, because you never know, or do a very careful evaluation to not C-spine these patients. Motorcycle crashes can be pretty bad. Depends on the amount of restraints or safety equipment these patients are wearing. Are they wearing a proper helmet? And in any of these, and even in the bicycle crash, all these patients wearing the proper safety equipment, and is it properly recognized by the correct agencies such as DOT for the amount of speed that they were going? Patients should undergo cervical spine assessment and have cervical collars applied. If indicated, look for deformity of the motorcycle, the side of most damage, and the distance of skid in the road. So the deforming stationary objects are the vehicles and the extent and location of the deformity in the helmet. I do try to find all the helmets as much as possible and take the helmets with the patients so that they understand what kind of helmet they'll wear also. So head-on crash with motorcycles, angular crashes, ejections, and laying the bike down. So most people that wreck a motorcycle are going to be coming off of that motorcycle 9 out of 10 times. You find very few that actually try to ride a motorcycle out. When training to ride a motorcycle, you're taught, to let go of it, hopefully, and proper techniques to actually be able to roll out of these crashes as far as bodily movements. So, fall is the greater the higher the fall, the greater potential for injury. Internal injuries pose the gravest threat to life. Identify the type of surface the patient landed on, how he or she landed, and take the following factors into account: height of the fall, type of surface struck, part of the fall that hit first, or part of the body that hit first, followed by the path of the injury displacement. Area of the body over which the impact disturbed, and always consider secondary other underlying medical causes of the fall. So, the geriatric community is going to fall a lot. We talked about this before, but always trying to make sure there wasn't a medical cause for the fall. People that just accidentally fall off of things or, fall down from doing something, always think about the fall pattern. Ask them how they landed. That will give you an idea of the dispersion of energy throughout the body and what kind of surface they landed on. Penetrating trauma can be classified as low energy, medium energy, or high energy. Low energy penetrating trauma can cause by impalement or intentionally by a knife, ice pick, or other weapon. Point blank or high velocity gunshot wounds will result in more significant injury. Angle or direction of travel is pertinent. If gunshot wounds, the internal organs that are injured may have no relationship to the entrance wound and the exit wound. So first determine the number of penetrating injuries, then combine that information with what you know about the potential pathway. With gunshot wounds, the path the projectile takes is referred to as trajectory. Frangible bullets will increase damage as multiple fragments increase the likelihood of multiple organs, vessels sustaining injury. Hollow point bullets expand as they enter the target in order to decrease penetration and cause more tissue damage. Full metal jacket bullets cause less damage than fragmented rounds. The bullet speed is a major factor in the resulting injury pattern. Cavitation results from the rapid changes of tissue and fluid pressure that occur with the passage of the projectile. A temporary cavity is produced by stretching tissue surrounding the point of impact. A permanent cavitation injury results closer to the bullet path where the pressure fluctuations are greatest and remains after the projectile has passed through the tissue. So bullets enter the body, it creates this cavitation due to the velocity in which the bullet's traveling and the spiral movement of the bullet, and it creates movement amongst everything around it. So I always think about that too. So the relationship between the distance and severity of injury varies depending on the type of weapon involved. Exit wounds are often much larger than entrance wounds. On the outside about that, please be careful in identifying entrance and exit wounds, because we are not forensic specialists. If you do have to end up in the court of law, please make sure that you can articulate the reason why you announce something has an entrance and an exit wound, because law enforcement may have done their own investigation and their own examination of the body itself, and they may say that it is something different. A lot of times I just put wounds and describe what is around them. So that you can understand the concept of what's going on. Blast injuries most commonly associated with military conflict. It's also seen the civilian practice has in industrial settings. So categories of blast injuries: primary blast injuries, entirely due to the blast itself. Damage to the body caused by the pressure wave generated by the explosion. Flash burns are part of the primary injury pattern. Organs generally affected are the lungs, eardrums, and other compressible structures. The proximity to the origin of the pressure waves is associated with high risk of injury or death. So this blast injury shows the mechanism of blast injuries. So you got your secondary blast, tertiary blast, and the quaternary blast, and what occurs in each one of those. So the secondary blast injuries result from being struck by flying debris. It may cause blunt and penetrating injuries. Tertiary blast injuries occur when a person is hurled by the force of the explosion against stationary, rigid objects. Injuries result from both blunt and penetrating mechanisms. Quaternary blast injuries result from the misblazing events that occur during an explosion. So heat generated during the explosion may cause burn. Quaternary blast injuries caused by biological, chemical, and radioactive contaminants that have been added to a traditional explosive. Tissues at risk: organs that contain air are the most susceptible to bare trauma because they can explode. Tympanic membranes can help determine the possible presence of other blast injuries. The patients may report ringing in the ears, pain in the ears, or some type of hearing loss, and blood may be visible in the ear canal. Pulmonary blast injuries result from short-range exposure to the detonation of explosives. Primary blast injuries often characterized by a lack of external visible injuries, and the patient may report tightness or pain in the chest. They may cough up blood. Pneumothorax is going to be your major, biggest concern. It is common and may require emergency decompression. Pulmonary edema may occur rapidly, and arterial air embolisms may occur. Solid organs are relatively protected from shock wave injury, but may be injured by secondary missiles or hurled body. Hollow organs may be injured by similar mechanisms as far as lung tissue. Underwater explosions result in the most severe abdominal injuries. And then neurologic injuries and head injuries are the most common causes of death from blasting. So multi-system traumas is injuries of a person who has been subjected to multiple traumatic injuries involving more than one body system. So you need to recognize patients who fit into this classification, provide rapid treatment and transportation, and alert medical control. So these patients do have a high mobility and mortality. So these are patients that have more than one system, bodily system involved into an injury. So you got a patient with a respiratory compromise, hemodynamic instability, and then a musculoskeletal instability injury also. That would be considered a multi-system trauma patient. So always ensure your safety, determine the need for additional resources or equipment, and evaluate mechanisms of injury, and identify the appropriately managed life threats. Assess and manage the airway while maintaining cervical spine and stabilization. So you may need additional help with additional hands. You need to determine what you need there. You may need additional resources. I would always encourage paramedic resources, also air medical resources, depending on the area in which you're in, and also your access to level 1 trauma centers. So ensure the basic shock therapy is completed. Rapidly proceed with spinal mobilization indicated during a transport, obtain a sample history, and for critical injury patients, consider paramedic intercept or air medical transport. Injuries to the head, disability or unseen injury to the brain may occur, and bleeding or swelling inside the skull from brain injury is often life-threatening. So injuries to the neck and throat, injuries may result in an airway problem. Look for deformities, contusions, abrasions, puncture, penetrations, burns, basically your BTLS in the neck injury, or in the neck region, Swelling may prevent blood flow to the brain because of the connection between the chest area and the brain itself. It's kind of a two-way valve, because then it goes out to that one particular area. Always use an occlusive dressing on any open neck wound. Air in the circulation or airway cartilage fracture may cause rapid death due to the embolism it can cause, and once it gets to the lung itself. Blunt force trauma to the ribs and sternum. Large vessels of the heart may be torn. Pneumothorax air collects in the chest cavity, compressing lung tissues, and it cannot allow the air to actually inflate back due to the positive pressure in there in the opening. Pneumothorax tension pneumothorax, heart becomes squeezed. Hemothorax, blood collects in the chest cavity, and reassess a trauma patient's chest region every 5 minutes, because this could develop over time. It may not initially happen during the injury itself. It can happen over time. Abdomen, the solid organs may tear, lacerate, or fracture. Hollow organs may rupture and leak toxic. Healthy young adults are able to compensate longer than others for blood loss. So always maintain your high index of suspicion. Reassess the abdomen region using BTLS. So have a good working knowledge of the resources available to you. Trauma lethal triad, hypothermia, coagulopathy, and acidosis are a major contributor of death in patients with severe traumatic bleeding. Fractures that interfere with the blood clotting will cause more blood loss. Aggressively seek to control all bleeding. Ensure IV fluids are warmed to be at least normal body temperature. Minimize the volume of acidic IV fluid administration to prevent interfering with coagulation and contributing to acidosis. Okay, limit your seat time to 10 minutes. So this basically gives you enough time to see these patients, control ABCs, and get on the road. That's basically what you're looking at with these patients. So the type of transport, several factors should be taken into consideration. Be familiar with local protocols, defining indications for use of air medical transport, and make sure these patients need air medical transport. Flying helicopters is a cool thing sometimes, and these folks that work on these helicopters like to fly. That's what they're there for. They want to take care of these patients and get them to the resource quickly. However, understand your ground transportation also, if you can manage these patients, while en route to a hospital. If you limit staying time to 10 minutes or less, and you're on the road, you know, if you're waiting to call for help, air medical, when you get on scene, you know, it's going to take them 10 to 15 minutes to decide they're going to fly, and then it's going to take them to transport time, the en route time, time to land, and then the time to transport and be at the receiving facility. If you're going to that same facility, you may be able to be at that facility just as fast. So, and here's some criteria for air medical. I'm not saying that you shouldn't use air medical. I'm saying think about all the um, effects that go into using air medical transportation. Another criteria to referral to a trauma center and what hospital resources available in your area, and transport to the appropriate facility based on patient. So trauma centers are classified levels 1 through 4. Levels 1 has the most resources, followed by levels 2, 3, and 4. Characterized by either adult trauma centers or pediatric trauma centers, and be familiar with how the American College of Surgeons Community on Trauma classifies trauma care. So you just need to become familiar with the trauma centers in your area and what levels they are and what resources are available to you regularly and 24/7. You know, having a resource on call versus a resource there when you arrive with that patient. You know, I always think about that. That's two different concepts. So two different things to help, you know, get into that golden hour. So that's the end of this chapter on trauma other injuries as soon as possible, improves the patient's outcomes, assess, triage, treat, and transport patients with traumatic injuries to the most appropriate facility.